Palliative care has been an important part of Paradigm Health ever since we opened our doors back in 2013. Palliative care is really a medical specialty that is provided much like a physician visit or a specialist visit.
Palliative care is an extra layer of support for the patient and the family. We focus on increasing quality of life. The patient typically will have a life-limiting illness, such as COPD or heart failure or cancer. Typically, they're referred at the time of diagnosis, and we help manage the quality of life they have during that illness and control those symptoms that arise with the illness so that we can keep them well and keep them home.
Often patients who are on palliative care will receive a referral for perhaps some home physical therapy, home occupational therapy, or home speech therapy, and those two can be provided at the same time. They are paid differently. The palliative part is paid under Part B, and the home health part is covered under Medicare Part A.
Sometimes you will hear the word palliative care associated with hospice care. And the important distinction there is that hospice is a form of palliative care, and it's maybe considered one piece of palliative care, but palliative care can be much more than just hospice. And that's what Paradigm Health provides. We provide a true community-based palliative care program that is much more than just hospice. Some of the benefits to palliative care are that it allows for more time with the patient and family. When a palliative care practitioner comes to see our patients, they may spend as much as 45 minutes to an hour or even more if necessary.
Palliative care with Paradigm does not replace clinical care. It is clinical care, but we collaborate with the whole physician team. So if you're seeing an oncologist, or if you're seeing a neurologist or a cardiologist, we're collaborating with that entire team to make sure the plan of care is followed and that the goals of care for the patient are followed. A palliative care patient would be someone who's suffering from a life-limiting illness, having symptoms that are uncontrollable, someone who wants to stay at home and not bounce in and out of the hospital. There's a lot of care that we can do at home through the palliative program. The patient and family can identify a need for palliative care when their quality of life is affected. Their symptoms are affecting their activities of daily life. They're interfering with things that bring them joy. The palliative team can come in, whether it be the nurse practitioner providing clinical support or medication support, or the licensed clinical social worker to provide some counseling, because there's a lot of anxiety that goes along with life-limiting illness. I would encourage families to reach out whenever they're feeling overwhelmed, because it's, like I said, it's an additional layer of support that can just coordinate and bring the pieces together for them.
One of the benefits of the Paradigm Health community-based palliative care program is that we're accessible 24/7. What that means to the patient and the family is that they can call us anytime. That provides such a piece of comfort and reduces anxiety knowing that we're always there for you.
So at Paradigm Health, the social worker plays the role of connecting to resources, and that can be helping get caregivers in the home. Often we refer to SACOA, which is the Council on Aging, for those types of services. They can help with transportation, help with meals, nutrition, etc. And we also refer to the VA for aid and attendance. The licensed clinical social worker at Paradigm can also provide individual counseling and help reduce or alleviate those symptoms of anxiety or depression. And we also do have goals of care conversations where we discuss things such as advanced directives, and we can help complete those types of forms.
In today's world, as we continue to face the threats of COVID-19, Paradigm Health has taken extreme measures to ensure the safety of our staff and those that we provide care for. One of the extraordinary measures that we have taken is that we are now requiring all of our team members, those that are out in the field providing care, to be tested for COVID on a weekly basis. This aggressive step ensures the safety of those that we serve.
Providing palliative care through Paradigm Health allows out-of-the-box thinking. We're community-based. We treat all of our patients and our referral sources as family. Our approach is thinking, how would you want your family treated? So that's generally the approach of patient care and community care with Paradigm.